Welcome to Didn't Get Frazzled presents The Flu Shot for Patients, 2016 to 2017. The flu shot is recommended for everyone 6 months of age and older. In this video, we will be focusing on adults age 18 and older. For information about infants, children, and adolescents, please see your pediatrician. We will discuss the CDC recommendations for the 2016 to 2017 flu season and answer common questions and concerns. Thanks for joining me. When should I get the flu shot? Peak flu season in the U.S. is December to March. Flu season begins as early as October and lasts as late as May. It's best to get vaccinated early in the fall before flu season gets underway. Since vaccine protection lasts about 6 months, the optimal time is October. Most flu shots are trivalent, containing the 2 influenza A strains and 1 influenza B strain listed on this slide. There's also a quadrivalent shot that contains an additional influenza B strain. We won't know if the extra B strain in the vaccine is really helpful until the flu season gets underway. The CDC does not recommend one vaccine over the other. Can the flu shot give me the flu? The flu shot is inactivated or killed virus, so no, you cannot get the flu from the flu shot. You can develop adverse effects, notably soreness at the injection site, low-grade fever, and body aches. The nasal spray offered in previous years can cause additional adverse effect, but is not recommended for the 2016 to 2017 season due to data showing reduced effectiveness. Do you get the flu shot? The flu shot is recommended for all adults, but is especially important for those in higher risk groups as listed on the slide. These groups include pregnant women and people with medical conditions like heart disease, respiratory disease, and diabetes. As a healthcare worker, I get the flu shot every year. The first year, I reacted with sudden onset of runny nose and persistent sneezing that lasted 40 minutes, but then resolved as suddenly as it came. Since then, I've never had any adverse effects besides tenderness at the injection site. If you've had flu-like symptoms from the flu shot in the past and are thinking about skipping it this year, don't. Most people's experiences are similar to mine. The only reason to skip the flu shot is if you've had a severe allergic reaction in the past. What if I'm allergic to eggs? You can still get the flu shot if you have an egg allergy. If you have a mild allergy like hives, you can get the flu shot just like everyone else. If you have a severe allergy, you can also get the flu shot, but you'll need to be monitored for at least 30 minutes in a medical setting. If that option still makes you nervous, consider getting the flu block, which does not use eggs in this manufacturing process. You will need to call around in advance to find out where this vaccine is available. Why do I need the flu shot every year? Your body's immunity to the influenza virus decreases over time. Also, influenza viruses constantly change through 2 processes. Antigenic drift results in small changes over time that occur when the virus replicates. This is why new viruses circulate every season. Antigenic shift results in an abrupt major change for which people have little to no pre-existing immunity. A shift last occurred April 2009 with the new H1N1 strain, the so-called swine flu, causing a pandemic. This slide shows the last 4 flu pandemics, all the result of antigenic shift. Deaths listed are estimated U.S. deaths. It's worth noting that the 1918 to 1919 flu pandemic caused approximately 50 million deaths worldwide. Thanks in large part to the flu shot and better antimicrobial treatment, the pandemics since then have been much less deadly. Is the flu shot going to be effective this year? No one knows, and no one will know until the flu shot is well underway. Here is the CDC data for the last decade on vaccine effectiveness. As you can see, the 2015 to 2016 vaccine correlated well with the circulating virus strains, while the year before, 2014 to 2015, the vaccine did not. Is there a better vaccine for someone age 65 and older? There are 2 additional options, both indicated only for adults 65 and older. Fluad is flu vaccine with adjuvant. An adjuvant is an ingredient added to create a stronger immune response. The Fluzone high dose contains 4 times the antigen dose to create a stronger immune response. For this vaccine, the safety profile is similar, but there are more frequent adverse effects. The CDC does not express a preference for these or any other vaccine. The most important point is to get the flu shot of whatever type you prefer or whatever is available in your area. Can I still get the flu if I get a flu shot? Unfortunately, yes. It takes 2 weeks to develop immunity, there can be a strain not included in the vaccine, or your immune system may not be strong enough to develop full immunity. Keep in mind, most people who develop respiratory infections during flu season have a cold. Cold and flu have similar symptoms. Flu symptoms are worse, with high fever, intense headaches, and severe body aches and fatigue. A stuffy nose and sneezing are more common to colds, but can also be seen in flu. If you have a fever or severe symptoms, contact your physician for treatment. Will antibiotics work? No, antibiotics treat bacteria, not viruses. Thankfully, there are 3 FDA-approved medications for influenza: Tamiflu and Relenza, which are oral medications available by prescription only, and Repivab, which is given intravenously. All work if given within 48 hours of illness onset. They shorten the duration of illness by 1 to 2 days and can prevent serious complications like pneumonia. How do I protect myself from the flu? The first thing you should do is get the flu shot. Next, wash your hands, especially after contact with high traffic areas like handles, rails, and ATM machines. And finally, avoid sick people and avoid people if you're sick. I know that sounds obvious, but Americans are particularly terrible about not going to work or school when ill. Do yourself and everyone else a favor and stay home. While you're home avoiding sick people, please go to Amazon.com and grab a copy of Didn't Get Frazzled, a novel exploring life and love in medical school. Reader's Favorite calls it a marvelous read, funny at times, even uproariously so, and poignant at others. This concludes Didn't Get Frazzled presents The Flu Shot for Patients. For additional information, go to my website, davidzhirsch.wordpress.com, and click Videos, where you'll find hyperlinks for all of the references discussed and all my other videos. Please like the video and click subscribe so you'll be notified whenever I post another detailed video on various common medical conditions. If you have any questions or comments about the flu shot, please write it in the comment section below. And as always, I wish you good luck and good health.